Good morning all. This is Kavipriya, lecturer from Department of Cardiac Technology, SNS College of Physiology Science. Now the lecture video is about blood pressure recording. Blood pressure recording is an essential, very essential one in cardiac physiology, representing the pressure within the major arteries during cardiac cycle. There are recorded as two numbers. One is systolic pressure, high in number, and the pressure is when the heart contract, which means diastolic pressure is lower number. The pressure is rest, between the rest, diastole. Okay, systole means contracted and diastole means relaxation. The third value is mean arterial pressure, that is average pressure between the single cardiac cycle and can be calculated by systolic and diastolic pressure. The systolic pressure is a maximal arterial pressure during the ventricular contraction, that is systole, and the diastolic pressure is minimum arterial pressure during heart is in relaxation between the beat, one beat to another beat, that is diastole. And the third one is mean arterial pressure, means MAP, the average pressure in arterial system over the single cardiac cycle, one cardiac cycle completion, after the completion of one cardiac cycle. After only marking the mercury up to 300 blood pressure is measured in millimeters of mercury, mmHg. Okay, recording is, it is conventionally systolic over the diastolic pressure, so it has normal ranges between 120 to 80 mmHg. And significance of cardiac physiology are to measure of cardiac output and the resistance. Measure the cardiac output and resistance are arterial pressure is directly linked to the cardiac output, and the arterial elasticity, peripheral vascular resistance. Then vital signs are, it is a key indicator of cardiovascular health. It helps to guide the clinical decision, and which indicate high blood pressure, that is hypertension. It is major risk for heart disease, stroke, other complications also. Then low blood pressure means it is hypotension, can lead to some symptoms like dizziness. If it is severe, can indicate the limit blood flow to the vital organs. And the cardiac cycle understanding, that is blood pressure changes within the heart drive the movement of blood through the body. It is often visualized by figure diagrams also in cardiac cycle, and also it get regulated by baroreceptors. It is located in the aorta and carotid arteries, and it is monitor blood pressure and send the signals to the brain to regulate it if it is hypotension or hypertension. So it is measured by two methods. One is direct and indirect method. Direct methods are using pulse, using catheters at all. We are using indirect method to measure the blood pressure, that is sphygmomanometer. The pressure cuff on the upper arm is first inflated once. The pressure well above the systolic pressure. At the point, no sound can be heard once if it is inflated, which is placed over the brachial artery, for the artery which has been collapsed by the pressure of cuff. And then the pressure is, cuff is gradually reduced, which means comes under diastole. That time when the systolic peak are higher than occlusive, which means artery get occlusion pressure, it support the cuff and cause the palpitable, feelable pulse in the wrist. Then also audible sound, coracough sound. It is generated by flow of blood and vibrations of vessels under the cuff and here through the stethoscope. The pressure of the cuff is indicated the manometer when the first coracough sound is heard, recorded as the systolic blood pressure. As the pressure in the cuff is continuously dropped, the coracough sound continue until the cuff pressure is no longer sufficient to occlude the blood vessels during any part of cardiac cycle. Below this pressure, the coracough sound will disappear and marking the value of diastole, which means relaxation of ventricles. Auscultatory methods are one is sphygmomanometer, stethoscope, and mercury attached to the manometer, then a stethoscope using mercury manometers or measures the height of column in a mercury level given its absolute result without any need of any calibrations, and The error also drifted to the calibration, which is which does not affect any other methods, which is use of mercury manometer. It is often required in clinical trials for the clinical measurements of hypertension and pregnant women, normal opinion patients at all. This is sphygmomanometer. A cuff of appropriate size, it is fitted smoothly and it is inflated by repeatedly squeezing the rubber bulb which is attached in the sphygmomanometer, and the artery is completely occluded that time. Once the cuff get inflated, the arteries got completely occluded, and listening the stethoscope, the brachial artery in that elbow. The examiner slowly realized the pressure in the cuff which is inflated. When the blood just start to flow in the artery, there is turbulent flow which creating the coracough sound. The pressure at which this sound is first heard